I think our goal today, there's two objectives. I wanted to like speak with you guys about, what you saw in that checklist that every school has to submit to the Mark Wilcox Center as far as what we're doing to like prepare for the pandemic. And objective number two will be to set like another meeting date for us to just like follow back up and talk about what we are talking about today. If there's any research that we need to do, that I need to do, so we can be ready to present this pandemic response plan checklist to the whole group. What we're trying to do is have a system in place at the school level, at the district level, like for all schools and like district employees. So one thing that I could see like from the checklist, and I know like objective number two talks about the social emotional impact of this like towards students or adults also. So I don't know if that's something that we need to touch on like in our group, but I do know that's one thing that I thought was missing from our checklist, like who supports that mission. I didn't know if that was something that we needed to add. Also, like timelines for everything, like going forward as far as the checklist is concerned.
Yeah, I was gonna address just some of the timelines because the things I've been hearing, like I know on the checklist it'll say like if somebody's tested positive, they have to be reported to the health department or the Mark Wilcox Center or whatever. They work in conjunction with each other. But I know that when the tests come back, like let's just say someone had symptoms and so they go and get tested. Well, whoever was in that classroom at the time, it's going to take like 3 days or 4. I don't know how long it takes in order to get back those results. So they were saying, like, what do you do in the meantime? Like if little Johnny in the classroom ended up getting tested and no one knows for another 3 days, is that public information that Johnny got tested? Or is it just kind of hush hush and then all of a sudden it comes out, oh shoot, yeah, we've been in here for 3 or 4 days, just all spreading it all around because he actually was tested positive.
Right.
So the time gap between like when they're tested, is that going to be public information? Because people are going to go crazy once that happens. You know, someone's tested because they think they have it, and then waiting like another 3 or 4 days and having everyone in the classroom infected basically before it even comes out if he's positive or not. So I don't know.
Very good question.
And then one other thing I know that they were talking about when I was hearing it was the nurses. So like I think on your checklist or the district checklist that we're looking at has that they would have a sick room, right? Is there like a sick room just in case one of the kids gets it, or if the one of the workers gets it, or like how? Or okay, so I'm thinking like for example, a kid shows up even though they're not supposed to be there, but let's say they have a runny nose or they have some kind of symptom of something. We don't know what it is. Now, do they have a separate room that they go into, or is it just a general clinic? Because if another kid's coming in with a straight knee, you've got little Johnny in there with his symptoms going on. You don't know if it's just a cold, the flu, the virus. You don't know what it is. So is there, I thought I saw something on here that there was a separate room.
Yes, ma'am.
There is something that the little Johnny would be placed in a separate room. But I gotta go back to your first question, wonder. So if symptoms pop up and you're in that waiting period, would it's to me, I would think as a parent, that's an automatic. You're home 14 days for the quarantine. You're quarantined until you have a negative test. I don't know if that's something.
Yeah, that's exactly. Yeah, that's exactly what I'm thinking. But I think the problem is that no one's going to know that little Johnny got tested until it comes out that he was positive. That's the problem. So like once he comes out and he's positive, then everybody in that classroom is going to have to stay home a mandatory 14 days. But really, it's not public information that he was tested. So I think that's the problem, because it's not an instantaneous thing. Once you're tested, then all of a sudden everyone knows. It takes time in order to get that test back, which means that those people are staying infected in that classroom.
That's definitely going to be a concern that we'll have to take a look at. The sick room bullet that you were talking about, it's under level 2 school. No, it's under level 1 actually. In, educational awareness, it's bullet number 9. So identify an isolation room for children with influenza-like illness.
Yeah, that's
so that's go ahead.
One other thing I was gonna talk about is what happens if the nurse gets it. So like, because I know there's a shortage there also, you know, like if that happens, and let's just say, I know this is another thing that I know is gonna come up, but let's just say you put this kid into an isolation room. Well, who in their right mind is going to go and be in there with that kid to supervise that kid, knowing knowing that you're basically going to walk into this situation? So like there has to be supervision in that room for all these kids that have to be isolated, but then who wants to be in there with them, you know? So that
school clinics are definitely like high traffic areas, especially at the elementary level, like middle school level. There's at any given day you can see like 5 to 7 kids in a school clinic, like an hour, probably even more than that. And you know, we do have clinic backups at my school, but even then, like what happens if the nurse gets sick and then the school backup gets sick? So it could be an endless cycle for sure.
And another thing I'm thinking of, like if that kid went to the nurse and then later on in a few days they figured out that they got tested positive, then does the nurse isolate for 14 days too? I'm assuming, because you're in contact with him. So that's, even if she's not sick per se, she would still have to follow those guidelines and be isolated for 14 days on and off every time someone comes in contact with her.
Absolutely.
And the thing about that's the separate room, the kids would need to be monitored in there, right? So someone would have to man that room essentially, but I can't see, that would be very difficult to send one of your employees in there knowing the possible situation that could happen in there. You know, everyone that walks in there could potentially get it.
Did you have something, Ms. Sullivan?
Yeah, I was just thinking about, I know that we haven't had a mandate here in Lakeland for the mask, but are masks going to be a requirement at, you know, for the office area? I don't know if that's going to help or anything. That's another debate. But when we're talking through monitoring and that exposure that it brings, like just thinking through what precautions are, you know, the front office staff and administration team going to be taking. I know for sure I don't want to walk around with a mask all day, but I don't know.
As of right now, masks are required. Obviously, we're on our summer schedule, so we don't have student traffic. But when we're in our office, when we leave our office, we should have masks on in our common areas like teacher workroom. Masks should be on. I'm in my office right now, so I don't have a mask on. But yes, masks for adults as of right now are required in our offices. Yes, ma'am.
And is that and that's going to be a requirement as well?
I can see it being a requirement. I don't think there's we haven't had a yes or no for students yet. I believe that's another committee. But for adults, I can definitely see that being a requirement. Yes, ma'am.
Yeah. But I know we talked about in the last call and just kind of working through what I'm doing with one of my children who was able to go to start camp. And of course, they get all kinds of precautions of less students. They're doing the temperature checks before they arrive, and and of course, educating parents that if they don't feel well, not to bring them. But hopefully, we don't get to this point, right? Because if we're doing temperature checks before the children enter the school, and if it's something that's showing up, then is it? I'm thinking at that point we're turning. If a child little Johnny has a temperature, at that point they're returning back with their parents, or their parents will be, if they come into the clinic, if they ride the bus, their parents will be called, so that still gives exposure. Okay. I have to think through the whole process of dropping them off, or how they get to school, and what happens when they get to school and all of that. So if we've got children that have rode the bus and then they've done or is temperature check going to be done once they get off the bus, and then at that point, then that's when if there is an issue, the kid goes to.
Oh, she cut out. Hold on 1 second.
Okay.
Sorry, did I lose you guys?
Yes, ma'am.
Okay. How do we work through exposure? So looking through the checklist, like with this particular pandemic and what we know, is it going to require a shutdown or a isolation of everything that child has been in contact with? Do we have to go that deep? Or?
Okay, so that can be something that I can research before our next meeting, because you're right, that's something that's not in our checklist. So like looking at the checklist, every school is going to look different. Like everybody's role. We're a very large middle school, so our crisis response team, we can have up to like 6 to 7 people, like working through different parts of like the levels within the checklist. But there's some smaller elementary schools or some smaller high schools. So every school is going to look different. Are we missing anyone from this checklist? Like right now, if you look at the checklist, there's mainly administrators that are listed there, and the school nurse. Like who else do you guys think we could like expand that checklist to like include other individuals to help with that response team?
Well, I think it goes back to that point that you brought up about the social piece, and I believe next time that was something that was going to be a part of the other group, as I understood it, but maybe I didn't. But I would say if anyone's missing, it's a social concept. And
Yeah.
Are you talking about in that group where you're the principal, assistant principal, terminal operator? That group there?
Yes, ma'am. Yes, ma'am.
So I would say the only thing that I see that's missing is the social, the social aspect of it.
I thought that too. And I do remember that I believe they're going to touch on that in objective 2, but I'll get some clarification on that, because that might be a piece that gets added to this this pre-plan, because that social emotional piece is definitely important in my opinion, because I think this has been like taxing, and it's worn a lot of people out, like physically and emotionally, obviously.
Right. And then as far as and two, just kind of I would think that person would be would be knowledgeable as to how what the steps are for the thing. Like, is there? I would think that group would have their own little checklist. That school counselor that can walk through how to help parents walk through this and get through it.
Absolutely. Yeah.
I think on the checklist, does it talk about if child has, what does it talk about when if child looks like they have flu-like symptoms when they come on? Because from what I understand, I think, and I could be wrong, but I think they're talking about doing temperature check.
What was that question? I didn't hear that.
Are you still there, Ms. Kobaba? Well, let me send her a chat message. I think she got disconnected. I think she got disconnected. Let's see if she can link back up with us.
I think that's what's going to happen, and they're going to, because what's going to happen is once the kids are on the bus, then Minister Duget is going to run into the issue of then once those kids have a temperature, they've already infected everybody on that bus for a half hour, 2 hours.
Right.
So I think that that's something that's already in the works, from what I understand. I mean, yeah, there was something else I was going to say. I forgot what it was.
Let me ask you, how much? And this may, and I don't know if this gets off of what we're supposed to be working on, but I just got to think the level of time that this is going to take. Added time doing this before, and as far as the support to get it done, I'm just a parent here, so I will let you guys know. I don't know if you heard me last week, but I'm in sales for Verity, so all I can speak to is being a parent. You guys are the wise ones as far as being in the education system and everything that goes on. But how much time is this going to take, and as far as support to put these extra steps in? I mean, some things I know can be established, putting the hand sanitizer stations on the buses and all that other stuff. But what about the temperature check? I guess that's the only added step. But is that going to be more? That going to cut down in the school day, or how is that going to work as far as timing?
I think like anything else, and a lot of it will depend on how many kids actually come to school, like based on like the different options that they have to like continue their education. So if you have a population like ours where we're one of the largest middle schools, 1,300 kids. If you have a population like that and everybody shows up, this absolutely will take some time. We have 23, 24 buses a day that drop kids off, take kids home a day. So that takes some time, but we'll see how many kids show up. But again, it's going to depend on like staff, like available hands, like also like not every school has multiple individuals that they can pull to like help support like something like this. So planning is very important. This preparedness plan, it's very important. So like the work that we're doing, hopefully we'll be able to help some schools asking those same questions. So it's going to take some time.
I think it's also just trying to be prepared for what's going to come at you. There's going to be a situation where like the rules are going to have to be enforced because somebody's going to show up with a fever. And then it always happens where, the person shows up, or maybe they get a fever halfway in through the day. And then you try to call the parent, and then the parent doesn't answer. Well, protocol is you just send that kid back to class.
Yeah.
So at this situation, there needs to be something else in place, or there needs to be some kind of, maybe they can just be sent to the sick room for the rest of the day if the parent doesn't answer. That might be some kind of something to do, because I know there's going to be issues where you can't get a hold of the parents once they drop them off. That's,
Yeah. It happens.
I know. I can take away, and that may be, I don't know if that's a part of Yeah, that may be something that goes in the I don't know which level it would go into, but what we did, what the camp that my daughter's going to is that basically, and I know as much as you educate and tell parents, there's probably still going to be some outliers in there that can't make it happen, but basically, we were told we had to, within 30 minutes, have some form of way of getting our child, I mean, transit-wise, or somebody on standby that could immediately, you know, remove our kid if they got sick as quickly as possible. And so I think that the designated route will be helpful to have, but also educating parents that they just need to be prepared. You know, hopefully it doesn't get to this point, and everything that we're working on won't have to be implemented because precautions are taken at home. But if so, if not, then I think that's an education piece for the parents as well, just to ensure that they know they've got to be prepared to pick their kid up immediately.
Yeah, and that's a great point. So looking at the plan, and we probably do need to add another point of contact for somebody to back the nurse up in making calls home to try to get student off campus. So that's a great point. So I will work on that also.
Yeah, I think for parents in general, this is gonna be a nightmare, because I know that parents are wanting to get their kids back, but with the numbers rising the way that they are, it just does not seem safe, number one. And also, I also think that, I mean, with this 2 week on, 2 week off, 2 week on, 2 week off, it's going to be harder for the parents to plan anything. To me, it would be better just to go virtual until these numbers start to drop, as opposed to going back face to face, and then every 2 weeks having half of the staff out, half of the students out, having the parents have to get babysitters every 2 weeks, or, I mean, it's just going to be a logistical nightmare. I think if we stuck with the virtual, which I know this is not our committee at all, but I'm just thinking, like, if we stuck with the virtual, at least the parents would know what's coming, and they'd be able to set up this childcare or whatever they have to do and be done with it, as opposed to they're going to be forced to stay home every 2 weeks if they have to, because that's policy from the health department, right? That
I believe 14 days.
So, to me, I'm like, this is gonna be a nightmare, because parents have to work. So if they're not planning on getting a babysitter, and all of a sudden they get a phone call saying, hey, by the way, your kid's been exposed and they have to stay home for 2 weeks, and then they go back for 2 weeks, and then the next week they get exposed again, I think it's just gonna be rough.
Yeah, a lot of questions, some answers, but a lot more questions than answers for sure. Ms. Sullivan, is there? Go ahead.
That kind of leads into our pandemic. The only thing that I thought was kind of missing, and I don't know if it needs to be implemented, but in between, almost like we've got something that says level 2 prepare for school closures, but what about the preparation for an individual student that may be impacted? Like, is that where, is there a packet of information? Does that kid automatically have to roll over to virtual? I know I had one of my children, it's been a while, but when he did virtual, it took a minute for us to get everything established. With those calls and so forth. But should there be a part of this preparedness is, if little Johnny was to, everything was done right, little Johnny was to come up and, had the flu and had to wait for testing, what in that preparation, is that just a matter of grabbing work from teachers and sending it home with him? Or is it that easy, or does it need to be something that's a little bit more designed? But that part of it, making sure that, he doesn't fall behind with this while he waits, to find out.
Yeah, that's a really good point, especially because, when he's out for 2 weeks quarantining, he might not necessarily be sick, let's hope not, But then you're right that he's missing out on education for 2 weeks. And then he comes back and then all of a sudden he's out again for 2 weeks. So I do see your point about the education part.
Yeah, and I think objective 3, there's a committee like outlining that with the ICP plan. So I think we will have like some direction there, like also. So like hopefully, I think we will have some direction there. So some really great points being made. Ms. Kobaba, is there anything else that you want to share about the crisis team plan?
I don't think I do. You guys have a janitor, like, do you guys have enough janitors and stuff to do these cleanings? Is that on there?
It's there. It's under recovery.
Okay.
That level 4 piece, but yeah, every school is different.
Yeah.
You know, keeping like staff like on campus, you know, like engaged like with the work on the janitorial side it can be like taxing and a struggle for a lot of schools. So that's another element, that's another question that will need to be addressed also. So
that's what I had. I had that. He's like, when I went through it, I was like, why does the cleaning come in recovery? I feel like, because I'm going back to, we got, let's just say, you know, Mr. Duché, it's your school and it's packed with students. So we've got 700. Little Johnny is, he's tested at, you know, before he's on the bus, but his fever's checked, but he gets to school and then those symptoms start to develop. And all the procedures that are in place with the crisis team are done. And little Johnny is, again, sent home for those, you know, to be tested and for those 14 days. Like in my mind, there should be a level of, and I don't know what we have access to, you know, as far as money. And I know things take money and budgets and all that, but like a cleaning process should come in between. Before we get to recovery.
Okay. So there needs to be a crisis team member like monitoring like
right.
the in-between cleaning. Okay.
Right.
Got it. Okay, Sullivan, is there anything else that you want to add?
No, sir, there's not.
Ms. Kobaba, anything else that you want to?
I think I've gotten everything that I had on my mind out so far. I don't know. I think I'm good.
It's a lot, but really great conversation. So what I'll do, I know we had some questions about that social emotional like piece. There should probably be a school counselor like leading that piece. I think we can talk about adding that to the plan. Let's see, the timeline was something else that we spoke about, something that we need to like think about, like putting into the plan also. What happens when and with who. Is there anything that I'm missing?
I don't think so.
I don't think so either. I mean, there is a pretty elaborate checklist, which is good.
So I know we're going to meet again as a whole group on the 8th. You guys have time to like come back and talk again on Monday or Tuesday?
Tuesday would be a better day for me. Monday or big heavy workload day for me.
Okay.
But Tuesday would be, I can definitely meet on Tuesday the 7th.
Ms. Kobaba, what about you?
Yes, if she can do Tuesday, I can do Tuesday as well.
All right, so we'll do Tuesday the 7th, same time at 9. And Ms. Sullivan, I'll try to figure out if there's another way to send you the link so you can join us on the Teams platform.
Will you send it to my, because I think, and I'm going to try to get my IT team to help me too. Will you send it to my work email as well, like put both emails on there?
Was that the Wish Farms?
Yes, at Witch Farm, and then maybe I can get it figured out that way.
Sure, I'll try that.
Okay.
Yes, ma'am. All right, guys. Thank you.
Thank you.
And we'll talk next week.
All righty. Thank you.
All right. Have a good 4th.
Bye. You too.
Bye.
You too.